Dr. Rinaldi, let's talk about heel spur. We hear so much about it, but I'm almost sure many of us don't really know what it means. Do you know what I mean? Explain it to us what it is and what treatments are available. And again, if there is something which a person can do to prevent it, maybe has a chance of preventing it or not getting it as fast, let us know that too.
Well, the reason you've heard so much about heel spurs is probably one of the most common things podiatrists treat. Patient will present themselves to our office complaining of pain after rest, which is an unusual presentation because most times
where do they have that pain after the rest?
They have pain directly in their heel, more than likely, and it would be right underneath the heel. Sometimes a patient will also complain of pain in the back of the heel along the Achilles tendon area. But for the most part, they get up in the morning, they get up from a chair, and they'll point to the arch area right where the heel begins. The word spur comes from a spur on a cowboy's boot, which is what you would see if you x-rayed a patient with a true heel spur. And the reason I emphasize the word true is a spur, to be diagnosed as a spur, doesn't necessarily have to have this true bony protrusion. The true bony protrusion is what a doctor will associate with a heel spur in a novice fashion to a patient. But most times, heel spurs are caused by the attachment to the heel, which is the muscle fascial belly. Right at the bottom of the heel, we've got three structures. They're kind of like rubber bands, and they tend not to stretch quick enough when someone gets up from rest. It actually is the bands that are not stretching quick enough, which creates the pain. The unfortunate part is years and years ago, when podiatry was in its infancy, and when Joe DiMaggio had a surgery and actually ruined his career because of heel spur surgery, what they did is they removed this giant heel spur, and lo and behold, the patient still had pain. We tend to now know that most of the pain is associated with these very tight fascial bands, and if surgery is undertaken, it is mostly directed to this fascial band as opposed to the actual bone itself.
I see. How is that done?
How is the surgery done?
Is that a surgery with some type of laser you go in, or is that the only way to do it, or is there some exercise, some creams? Is there other stuff also which not only masks the pain, but perhaps gets to the source and gets it away?
Yeah, let me answer your question in a kind of backward fashion, and that is, the last thing would be surgery. The surgery itself can be many, many different types. It can be a cutting surgery, a traditional surgery, which is what Joe DiMaggio had many years ago. And the problem with that is, to get to that heel spur, you've got to go through many muscle bellies, and the rehabilitation for that is very difficult. There are surgeries that involve ultrasonic waves, the same way that kidney stones today are broken with these ultrasonic waves, which is a treatment for it. There are endoplasty procedures, a fancy name, almost like arthroscopic surgery, where we can go in with tiny little cuts made into the side of the heel, which can even be done in an office setting, as in our practice, or in a medical facility, an ambulatory surgical center, where you can visualize the small fascial bands and actually cut them under a magnifying telescopic lens. Those are the surgical procedures. And again, those surgeries are done when conservatively you cannot get the patient better. You mentioned and touched on lasers. Lasers are one of the treatments for heel spurs. The reason it's one of the treatments for heel spurs is because the lasers today can penetrate to the fascial area and decrease the inflammation in the fascia itself. You can introduce medicine, soluble steroids, insoluble steroids, that can dissolve at the area and reduce the inflammation around that fascial structure. Different forms of stretching exercises can be performed. And those exercises, because part of your question was how can you prevent a heel spur? You can prevent a heel spur by doing certain stretching exercises, especially after activities. And they can be as simple as bands put on the bottom of the foot and pulling the foot towards the nose. I almost would like to lay on the floor and show you, but those are ways that we can actually stretch the heel cord and stretch the fascial bands to reduce the possibility of fasciitis and heel spurs.
Okay. All right. I mean, since you say that, you want to bend your foot towards the nose, isn't that what we do when we get a cramp in the leg? We'll try to do that. That usually relieves it. Is that the same kind of thing? Does it have anything to do with one or the other or not?
Well, certainly that could be one of the ways people try to get rid of cramps other than running into the bathroom on a cold floor. But for the most part, by extending the foot, as I'm doing with my hand, and putting a band on the bottom,
right,
and this being your leg, you stretch the bottom of the foot, which is where these bands occur, and you hold that to a point of tension. Sometimes I tell my patients, especially if they have young children, make it a game. Let the children press on the bottom of the foot instead of using bands. Just hold it to a count of 10, let it go, do it again, and eventually you will get that stretching, and maybe your mornings will be a little bit better.
Okay.
While we're on that subject matter, certain oral anti-inflammatories can help, just over-the-counter things like an Advil or Tylenol. And always, wear that orthotic or wear that sensible shoe where you can fit an orthotic into and control the foot.
Yeah, we're definitely going to have to talk about orthotics a little bit more because with no doubt they seem to be fixing just an awful lots of things. I have heard all the way up to headaches. So much for the heel spur right now. Thank you very much, Dr. Rinaldi. We'll speak to you later.
Thank you as always.